So today we're going to do stretches from the comfort of our own chair. We're going to do 3 stretches. We're going to do pelvic rocks, we're going to do a rectus spinae stretch or hug a knee stretch, and we're also going to do a glute stretch. So the first one is a pelvic rock. So this is by far my favourite stretch of all time. I prescribe it for pretty much everything. It's so good for anyone looking into core stability. It's fantastic for low back. It really sort of mobilises the lumbar spine. It mobilises the sacroiliac joint. It's just an all-rounder really. So for this one, what you want to do is just sit on the edge of the chair, nice and tall, find the small of your back, and then just push backwards. Okay, so just a little bit of a rocking action. I'm just going to turn around so you can see. So again, nice and tall, find the small of your back, and just push backwards. Now it's really important with this one. You will find that your shoulders and your knees are going to move a little bit, but what we make sure is that you're not over exaggerating it. So you don't want this to happen, and you don't want to do a pushing line on the chair. So it should really just come from your low back. So just to show you again, just pushing backwards like that. Now I did mention as well, it's really good for core stability. A lot of core stability exercises, they talk about the neutral spine. So the idea is with a pelvic rock, you just want to kind of exaggerate it, and the neutral spine is in the middle. So if I just show you, you want to exaggerate, and my neutral spine will be about there. So anyone interested in doing core stability exercises, give a pelvic rock a go. It'll be so much easier after nailing a pelvic rock. The next exercise is the hug a knee stretch or a rectus spinae stretch. And basically your rectus spine muscle, it runs all the way down your spine, and it's just a really nice stretch for it. So I would generally prescribe this for low back complaints. However, because it runs parallel to the spine, even if you're having sort of mid-back, neck issues, you still get a really good stretch out of it as well. So to stretch, what you would do, you just want to sit on the edge of your chair, you're going to flop forward, tuck your head under, and you'll just feel a nice stretch coming all the way down. And you just want to hold for about 10-20 seconds. For this stretch, I would actually give it to most patients. So I'd actually give it for the really restricted patients. So any sort of the rugby players of the world, and really stiff, not much sort of mobility in the back, I'd give it for them. I'd also give it to sort of the hypermobile patients. So anyone suffering from joint hypermobility syndrome, the flexible gymnasts and ballet dancers we get coming in as well. The idea is it's just very easy to calibrate this one. So for example, if you're a rugby player and you're really stiff, you might just find that this is as far as you can go, and that's absolutely fine. Whereas a gymnast, they might go all the way for they might go past, and they might sort of be able to sort of touch their toes, things like that. Good news is, because your legs are in the way, you can't physically go any further. So it's a nice one to avoid any injury. We're taking that pressure off the hamstring, so there's no sort of real sort of risk of injury while doing this one. So that's the hug a knee exercise. So I'll just show you from the front as well. So you just flop forward, hug your knees, and tuck the head under as well there. And like I say, I'll probably hold for about 20 seconds just to get a really good stretch in the back. The final exercise is the glute stretch. So the glutes are such a big muscle group. They are the largest muscle group in your body, and they're actually responsible for an awful lot as well. So any sort of faulty moving patterns, it can sometimes come from the glute. Any sort of low back issue, sciatic pain can come from the glutes as well. You can get sacroiliac joint problems as well from the glutes. So it's a really good idea to stretch them anyway. So what you want to do is just cross one leg over like so, and you're just trying to ease your knee to the floor. Now, if you can't feel it, try and lean forward and you'll feel that straight away. So yeah, just ease to the floor. It doesn't matter if you're there or if you're sort of there. You just want to just ease it to the floor and just hold for about 20 seconds if you can. Do both sides if you can as well. So we'll just do that one as well. There we go. And like I say, you should just feel a bit of a stretch there. Don't worry too much if you find there's a difference between the two sides. So you might find one side is here, the other side is there. Just go within your means. So if this is as far as you can go, just hold it there. That's it. And then just give that a good old stretch. And that is it.